Hello and welcome to today's webinar, Unlocking the Potential of STI Testing in Urgent Care, Business, Population Health, and Clinical Perspectives. My name is Samantha Burke. I am NARUCA's Administrative Director. Now, for those of you who don't know, NARUCA is in its 12th year of existence, and today, NARUCA provides grassroots local representation in partnership with UCA's National Strength. We integrate urgent care medicine into broader public health initiatives, and we provide education and advocacy for urgent care medicine in the Northeast region. Now, lastly, I would like to thank our platinum sponsors for their continuing support, HealthTrack RX. And with that, it is my distinct pleasure to introduce you to Ben Fabre.
Thank you, Samantha. No matter your role in urgent care, today's webinar has something for you. Here's why. Today, we're going to discuss the clinical, operational, and financial challenges and opportunities regarding treatment, a special patient type, patients with sexually transmitted infections, unlocking the potential for STI testing in urgent care. My name is Ben Fabre. I'll be your host for today's session. Now let me introduce our experts. We begin with Alan Ayers. Alan's the president of Urgent Care Consultants. Alan, you've published extensively on improving urgent care operations and efficiency. Thank you for joining us today. Next, we have Dr. Stephen Goldberg. Dr. Goldberg is the Chief Medical Officer of HealthTrack RX, and more importantly, is an emergency room physician and an urgent care physician with the University of Louisville Health, and really understands what it's like at the front lines treating these patients. Ali Prigo is the Medical Science Liaison for HealthTrack RX. She's also a physician assistant with Modern Pediatrics. What I'm concerned about is at the bedside, dealing with these patients, it's a different patient type and they have unique concerns. Walk us through that part of getting into this business. What's the personal part? Who are these patients? Help us understand who they are, how to treat them, and how we work with them.
Absolutely, Ben. The one thing we should take away from my part of the discussion is that there's a variety of diagnostic tools that urgent cares can utilize to diagnose STIs, and that's really important because speed matters. It matters for the provider, it matters for the patient. That ultimately may be the reason why they choose the urgent care space to seek care for STI testing to begin with. As we've already touched on earlier, we know it's crucial for clinicians to diagnose and treat STIs as early as possible to prevent complications. What I'm going to touch on are what are your actual options? What do they look like? What's available to capture and diagnose these STIs in the urgent care space? And then we'll look at a couple of patients presenting to urgent care for STI concerns. As you can see, there are a lot of different options available for STI testing, and there's benefits and drawbacks to each of them, and we'll go through that. So your first option is nucleic acid amplification test and PCR. So these are highly sensitive, highly specific, typically accept various specimen types. They do usually require some sort of laboratory infrastructure. They can have longer turnaround times compared to point-of-care test. On the other side of the coin, point-of-care test, they give you rapid results, pretty useful in settings with limited access to laboratory facilities. A drawback of some point-of-care tests is that they may have lower sensitivity and specificity compared to your laboratory-based PCR, and the scope of pathogens can be limited. A lot of these point-of-care tests are moderately complex instruments, which urgent care sometimes aren't equipped to operate. So something to keep in mind. Wet mount microscopy or your wet preps, typically inexpensive and rapid since it provides point of care results, but it can have lower sensitivity that's time sensitive and requires a skilled operator to use. Serology, definitely a crucial, essential in HIV and syphilis diagnosis, and it has the benefit of being able to detect past infections and screening your asymptomatic patients. But serology sometimes cannot detect active infections in the early stages, and it may require confirmatory testing 6 to 8 weeks later. And then you have your bacterial cultures. This allows for antimicrobial susceptible testing, but it does require specific transport conditions. It can be timely to process, and it can have a timely turnaround time. There are a few rapid antigen tests commercially available now for STI diagnosis. These provide quick results, kind of like point-of-care tests. They're easy to use, but they can have lower sensitivity and higher rates of false negatives. So now that we've looked at the options that are available for STI diagnostics, let's just do a dive into some patient profiles that we have for patients presenting to urgent cares for STI testing. So here we have Chelsea. She's a 20-year-old female attending college, and she's symptomatic with abnormal vaginal discharge after her first sexual encounter. She wants to be checked for everything bad, in her words, but also doesn't want her financial claim record. What diagnostics may a provider consider for Chelsea? She wants to get checked for everything bad, so more broad testing may be utilized. Some diagnostics that could be helpful for Chelsea is point of care or PCR tests to check for chlamydia, gonorrhea, trichomonas, serology to expand to look for HIV and syphilis, perhaps hepatitis, maybe a wet prep to look for BV or yeast. HSV can also sometimes cause vaginal discharge, so a point of care test may not be the best option if we're looking for this virus. So PCR may be used if the provider wanted to test for this in particular. Let's think back to barriers to patients seeking STI testing in the first place. This patient could still be on her parents' insurance and maybe doesn't want her parents knowing that she is getting STI testing. There could also be some cost considerations in play as well, or urgent care could just be more accessible to her since she may be living somewhere different than where she grew up and she doesn't have quick access to her usual primary care providers. And now we're going to take a look at Mike. Mike is a 52-year-old, recently divorced male complaining of new onset of burning with urination, also has a new sexual partner in the last week. He's not so concerned he has an STI. It's on his radar, but he thinks he may have a UTI. But something to note is that Mike does not have an established PCP. As far as diagnostics, a provider may opt to do more targeted diagnostics for Mike. They may check the UA for signs of UTI, but we know in male patients, urethritis is more prevalent. So a provider will likely consider STI testing via a PCR test to check for chlamydia and gonorrhea at minimum. But why didn't Mike choose urgent care in the first place? Pretty simple. He doesn't have an established PCP. And this isn't an uncommon issue. More than 100 million people in the US don't have a primary care provider. So this patient needed immediate access to a healthcare service, and the urgent care clinic he walked into helped fill the access gap he needed. Finally, we're going to take a look at Diane. Diane, she's a 38-year-old female complaining of a week of malodorous vaginal discharge. She is in a monogamous marriage. She reports that she's concerned she may have an STI. Unfortunately for Diane, her next available OB/GYN appointment is 6 weeks away, and she also desired to have care from a provider she didn't have a long-standing relationship with due to her concerns about potentially having an STI. For Diane, diagnostic testing could start as targeted initially, which could include a wet mount to look for trichomonas, BV, and yeast, since vaginitis would certainly be on the differential for her. And this could be done as a point-of-care test as well. PCR testing for gonorrhea and chlamydia and trichomonas would likely be used as well. Serology testing for HIV and syphilis could be used if the provider determines she's high risk or if there's been an exposure. But since she's early on in her symptoms, she may need to repeat serology 6 to 8 weeks later anyway. But let's look into why did Diane come to urgent care over her OB/GYN, over her PCP. There was a long wait time to get seen by her OB/GYN, and that's in alignment with the 19% increase in wait times for OB/GYN appointments since 2017 that Dr. Goldberg pointed out. She also said that she desired more privacy with her sexual health concern, especially if this is her first time seeking STI testing. So the urgent care setting gave her a perception of increased discretion. So what do all these patients have in common? Speed matters. Urgent cares offer convenience, accessibility, as they often offer walk-in services, they have extended hours. If a patient is experiencing symptoms of an STI, an urgent care provider could give quicker results or guidance compared to waiting for an appointment with their primary care providers. And then there's the fact that not everyone has a regular PCP or women's health provider, so urgent care can be faster and fill that gap. In summary, I mean, each patient's reasons for seeking urgent care for STI testing, it depends on personal circumstances, convenience, comfort level with healthcare providers. But at the end of the day, speed of diagnosis and speed of treatment is very important for both urgent care providers, clinicians, staff, and the patient themselves.
Great job, Allie. Thank you so much. A couple closing thoughts. One is the high prevalence of STIs today and the growing demand is really, the silver tsunami is kind of one of those terms that's just stuck in my head. So I think this really kind of creates an overall impact across all demographics. It's not any one patient type. It's everybody you see walking into your clinic today has a high probability at some point needing STI testing. So you're already treating these patients. They may not just be coming to you, which I think is kind of a new way to think about it, to Alan's point. The long risk health consequences to STIs, if you're a young lady or gentleman looking to start a family, if you don't get taken care of sooner rather than later, this can be a life altering event. And the success of treating it and getting that treatment is profound. The opportunity for urgent care, Alan, when you laid out those statistics around half the practices not doing this testing, that was shocking. And then to see that the best practices are doing it, success is simple. Find what works and consistently reproduce it. And this is something that just kind of jumps out there is that if I'm not in this business, I'm fighting with one hand behind my back. And then, Allie, I thought just a great job on the operational efficiencies, what testing to use, and then how to deal with these patients. Because really, it's about getting patients healthier faster. That's what they care about. Every clinician I know, that's what they care most about. With that, we'll conclude today's webinar. Thank everyone for participating today.